A stark warning for South Carolina. Counterfeit pills are fueling a deadly surge. What looks harmless could be hiding something lethal. Well, we want to welcome Michelle Nienhius, Manager of Prevention and Intervention Services for the South Carolina Department of Behavioral Health and Developmental Disabilities. This is such an important topic that we should be talking about because a lot of people, they're ordering pills online, they're getting them from illicit sources. What if one pill could cost a life?
Absolutely. We know that unfortunately, if you take a pill that is not given to you by a licensed pharmacist, it could contain substances like deadly fentanyl. And that is can be very deadly.
And it's not even just illicit drugs that the fentanyl is making its way into. These are other drugs that people do use and get prescriptions for. Can you give us a few examples of what those might be?
Sure. Unfortunately, we have seen fake oxycodone pills. We've seen fake Xanax pills, Adderall pills. So there are different types of pills like that, like you said, people have legitimate prescriptions for.
Yeah.
However, they may not be getting those prescriptions filled at a legitimate pharmacy. Maybe they need to save themselves a little money, or maybe they just, don't have the opportunity to go to the pharmacy and they're choosing to buy them online or buy them from an illicit substance out there. And then they're taking those pills, and unfortunately, they could be causing deadly consequences.
Indeed. Is there one particular source that you're finding people are getting their hands on these counterfeit drugs? Is it through online? Is it the dark web? Is it someone down the street? What are you seeing?
That you're naming them.
Okay.
We are seeing various sources where folks are getting deadly pills. And the main thing is that as an individual, you shouldn't take a pill that's not prescribed to you. You should not take a pill that you do not have access to legitimately. We've seen, especially with young people, they may take a pill from a friend or a family member that didn't come from them having a prescription. And so we want to make sure that young people, youth, and adults are aware of the fact that you should never take a pill from someone that was not prescribed to you and not given to you from a pharmacist.
Absolutely. What is the origin, the typical origin of these drugs, where they're manufactured?
We see that several of the pills are produced locally, but they're getting the chemicals from various places, whether it be from Mexico or China or other countries overseas, and the information, the drug supply is coming into the United States. But some of the places have their own pill presses, and so it can be very difficult to tell the difference between a fake pill and a legitimate pill.
That's right. They're identical, same color, same shape. It's really quite remarkable. And if someone were to ingest, I mean, we talk about fentanyl, for instance, you don't necessarily overdose on fentanyl when it's snuck into one of these pills. I mean, that's actual poisoning. So just a little tiny bit could cost you your life.
Absolutely. And the thing is that when the pills are manufactured outside of a regulated facility, they are not uniform. And so a person who's pressing their own pills may have 10 pills that they press, 2 may contain the fentanyl, the other 8 may not. Or they may be in different areas of the pill. It could be that the fentanyl is not evenly distributed throughout the pill. And so if you were to break that pill in half, and let's say you took a half of the pill and I took a half of the pill, you may not experience any issues. I may experience the issues because the fentanyl may be in the part of the pill that I took.
That's so frightening.
So we see that uneven distribution happening when the pills are manufactured in places outside of those regulated facilities.
So in the event that you see someone that could be either poisoned, overdosing, however you want to describe it, how do you recognize the signs? What are the symptoms? And what should you do?
Absolutely. So some of the signs that you may want to recognize in the case of an overdose is when you hear gurgling sounds or
Mm.
you notice that the breathing is slowed or very shallow. The individual also may have a bluish tinge to their lips or their fingertips because the oxygen isn't reaching that part of their body.
Mm-hmm.
They may be unresponsive and or they may have pinpoint pupils. So if you notice any signs of an
Okay.
overdose, you want to call 911 immediately. You
Mm-hmm.
want to get help on the way.
Okay.
And if you have naloxone available, you want to administer that naloxone. A lot of the naloxone that is over the counter is nasal, and so you're able to just place the unit in the person's nostril
Mm-hmm.
and push the applicator, and then the medicine is delivered via the nasal
Okay,
cavities.
and those you can get for free, and they're available at distribution centers across the community. So we're going to put up on the screen more information where you can find it, where you can go. Michelle, thank you so much for this really life-saving information.
Thank you so much.
We'll be back after this.